Alright, my friends, today we're diving into the world of ADHD medications and are going to be taking a closer look at Strattera. Whether you or someone you know has ADHD, it's important to know what sets Strattera apart from other medications out there and what to consider before starting it. In this video, we'll be counting down the top 7 must-know facts about Strattera, so don't miss out. Fact number 1 that I need you to know about is that Strattera, which is also called atomoxetine, was the first non-stimulant medication to be approved by the FDA for the treatment of ADHD. It was initially approved in 2002 and became generic in 2017. It's considered to be a selective norepinephrine reuptake inhibitor, and it helps treat ADHD by increasing norepinephrine and dopamine levels in the frontal lobes of your brain. And it does this by blocking the reuptake of norepinephrine, which helps improve focus and attention. Fact number 2 is that Strattera is effective in treating ADHD. But how effective are we talking? And how does it compare head-to-head with stimulants? So when determining how effective a medical treatment is, doctors look at the number needed to treat, or NNT for short. This tells us how many people need to take the medication in order for one person to benefit from it. The lower the number, the more effective the medication is. So for example, if the number needed to treat is 10, it means that 10 people need to take the medication in order for one person to benefit from it, compared to those who did not take the medication. Make sense? Okay, so the number needed to treat for Strattera is 5 to 7, so really not bad. But how does this compare with the stimulant medications? Well, the number needed to treat for stimulants is 2 to 4, meaning that stimulants are more effective, and there were 2 head-to-head trials that I found that further demonstrate this. The first study compared Strattera to Concerta, which is a methylphenidate-based product, and it found that both treatments were effective in treating ADHD. But the Concerta showed greater overall improvement when comparing the 2 medications head-to-head. The other study compared Strattera to Vyvanse, which is an amphetamine-based product, and it found that Vyvanse was more effective than Strattera for patients who didn't respond to methylphenidate, with 75% responding to Vyvanse and 55% to Strattera. So overall, stimulants are considered to be more effective than Strattera for treating ADHD symptoms and are usually used as a first-line treatment, whereas Strattera is usually used second or even third line. So knowing this information, why would someone prefer Strattera over the stimulants? Well, fact number 3 I need you to know about is that most people tolerate Strattera better than the stimulants. Studies suggest that around 10 to 20% of people stop stimulants because of side effects like loss of appetite, weight loss, growth inhibition, sleep problems, worsening of tics, or even mood changes. These effects are usually less common with Strattera. Additionally, Strattera might be safer than stimulants in those with certain heart conditions. The main side effects that we usually see with Strattera are often GI related, so nausea, vomiting, and abdominal pain. Other commonly seen side effects can include headaches, high blood pressure, and faster heartbeat. If someone experiences these side effects, I often encourage them to split the big dose into 2 smaller doses taken throughout the day, and this usually reduces the side effect. An interesting and surprising fact about this medication is that unlike stimulants, which can cause insomnia, most people who take Strattera actually feel tired on it. Fatigue happens in approximately 1 out of 20 patients. Now, since we're talking about side effects, fact number 4 to know about is that Strattera has a black box warning on its label for the potential to cause increased risk of suicidal ideation in children and adolescents. Studies on this are mixed though. A 2008 meta-analysis found a small but significant increase in suicidal thoughts among patients with ADHD taking Strattera compared to those taking placebo. It was seen in 5 out of 1,357 patients, or 0.37% of people. However, a 2014 meta-analysis later found no significant increase in suicidal thoughts. So what's the main takeaway here? It's important to be aware of this potential risk and to contact your doctor if any major changes in mood or thinking occur after starting the medication or when changing the dose of the medication. These are the most common times where these side effects pop up. All right, my friend, I know that this can be a lot of information to take in. So to make things easier for you, I prepared a Strattera medication fact sheet that you can download today. This way, you can keep track of all the important information we've covered in this video. Simply click the link in the description below to access it. Now, fact number 5 I want you to know about is how to dose Strattera. My approach is always to start low and go slow. So for those who are 70 kilograms or less, which is around 154 pounds, the initial starting dose is 0.5 milligrams per kilogram per day. We then increase the dose gradually over time to a target dose of 1.2 milligrams per kilogram per day, with a max dose of 1.4 milligrams per kilograms per day. Now, for those who are over 70 kilograms, the starter dose is 40 milligrams per day, the target dose is around 80 milligrams per day, and the max dose is 100 milligrams daily. The goal is to find the lowest effective dose because this helps reduce the chance of side effects. And then don't forget that it could take up to 12 weeks before we see full benefit of a given dose. With talking about dosing, we also need to talk about drug-drug interactions. And fact number 6 to know is that Strattera is metabolized through a single pathway in the liver called the CYP2D6 pathway. And taking other medications that block this pathway, so fluoxetine, which is Prozac, paroxetine, which is Paxil, duloxetine, which is Cymbalta, sertraline, which is Zoloft, and bupropion, which is Wellbutrin, right? All of these medications can block that pathway and lead to unwanted side effects because the drug levels of Strattera will build up in your system more aggressively. So when taking these other medications, in addition to Strattera, it's important to start with an even lower dose and to increase the dose slowly. The target dose should be around 50% less than usual, and the dose should be raised as half as fast. Fact number 7 to know is that Strattera is often viewed as being beneficial in those with ADHD plus anxiety. A 14-week study with 442 adults showed that Strattera outperformed placebo in managing symptoms of ADHD and social anxiety disorder. However, it's not effective for those with ADHD and depression. If you have depression in addition to ADHD, Wellbutrin may be a better medication worth considering. If you're looking to learn more about this medication, make sure to click that top video.